Auzubillahiminash-shaytanir-rajeem. Bismillahir-rahmanir-rahim. I am Dr. Shahzad Wasim. I hope you people are in good health. The topic I have chosen today to talk on is the difference between cataract and glaucoma. That is, सफ़ेद मोतिया और काले मोतिया में क्या फ़र्क होता है. So in this small video I will just emphasize on the basic differences which will be useful for both the medical students, hopefully inshallah, and for the general public who have some confusions about these two things. As far as Sfaid motia or cataract is concerned, it is basically not a disease as such. It is just the opacification or whitening of the transparent crystalline intraocular lens which is placed in our eye by nature since birth, and with the passage of time, as our hair gets white, our skin becomes wrinkled. In the similar way, some changes, chemical changes occur, that is degeneration of the proteins of which this lens is made up of are degenerated, and it takes the form of a white lens which we called cataract, and in Urdu it is used to be called Sfaid motia because it looks like the flower of motia. And symptoms in this disease is gradual decrease in central vision for the far, and paradoxically the vision for the near becomes good because the refractive index of the lens is increased, and the rays of light are formed usually in front of the retina, and patient says that he can see well at the near, but his vision is deteriorating for far and he cannot recognize the faces. So this is cataract, and the treatment is removal of the lens and placement of intraocular lens, and after the operation patient's total visual rehabilitation occurs and he can see very clearly for far, and for near he has to wear the glasses as everyone has to wear after 40 years. As far as glaucoma is concerned, or kala motia, it is also called a silent killer because it is basically a disease of optic nerve. So it is a neurological disease. By definition we call it a neuropathy, an optic neuropathy, and there are three main signs of this disease, but the symptoms, if I talk about, usually the most common form of it is called primary open angle glaucoma or simply glaucoma or kala motia. Patient does not know that he is having or developing glaucoma because it does not involve the central vision, and patient can see very normally in the center, and if checked his vision is usually 6/6. So he is unaware of the fact, and at times he feels that he cannot see the things which are on sides, on right or left side or upper or lower side of his eye. They are affected. That is peripheral vision, which we call visual fields, are affected, and the patient usually comes for with vague complaints of off and on blurry vision, or he sees different colors like rainbows because of corneal edema, uh, and corneal edema occurs because of raised intraocular pressure, which is a sign of glaucoma. The reason is not yet known, and on examination we come across the signs, three signs of glaucoma: the raised intraocular pressure. On the optic disc we find the optic disc cupping or optic atrophy, in, you can say, in simple language, and there are typical visual field effects, peripheral visual field effects, which we see on special machine, which we call perimetry. And this disease is very different from cataract. It is not that simple to treat. The treatment option is to decrease the intraocular pressure by eye drops, and the patient has to use the eye drops for rest of his life, and we have to achieve a pressure. First of all, we have to know what is the target pressure, that is the pressure at which the retina is not damaged. If the normal pressure is between 10 to 20 mm of mercury, if it is 21 mm of mercury, then we become suspicious. So maybe in most of the patients 16 mm of mercury is the target pressure. In some patients it's even lower. So we give the drug medicines, and we keep the patient follow up for life. First for every 1 month, and for 3 months, and 6 months, and 1 year. And if the patient uses the proper drops, we can decrease the progression of the disease. But unfortunately, we cannot reverse the disease. The damage which has been caused by the neurological deficit, which has already occurred in ganglion cells and optic nerve, that cannot be reversed, as it is a part of nervous system. But we can stop or decrease the progression of the disease. And we ask the patient, you may forget to eat, but don't forget to instill the eye drops. So this is the main difference. Lens is totally normal in glaucoma, but it can be a devastating disease if not treated well, and patient may go blind, as opposed to cataract, which is very treatable. And in the end, by the way, cataract is the most common cause of reversible blindness worldwide, and glaucoma is the most common cause of irreversible blindness worldwide. So not to worry about, but go to a regular checkup to an eye specialist after the age of 40. And if you find some signs, unfortunately, then you have to use the medicines properly to avoid the consequences. I will stop here. Please in the comment box write down what you want to hear and on which topics you want me to talk about. Thank you very much for now. Allah Hafiz.